Welcome to the Nurse Edu Network. My name is Janae. In this video, I will continue to review Domain 1, Facilitate Learning for the Certified Nurse Educator exam. In this presentation, we will focus on Subcategory B of Domain 1. By the end of this presentation, you will be able to use teaching and learning strategies that are based on educational theories and evidence-based practice related to education. Learning results in a change in mental processing, emotional functioning, skill, and/or behavior. The nurse educator uses educational theories to explain the relationships between concepts in the learning process. They are used as the foundation for creating teaching strategies. The teaching strategies should align with the nursing program's philosophy and meet learning outcomes. The first learning theory we will review is behaviorism. Learning is based on observable changes in behavior. For students to achieve the change in behavior, they need practice and reinforcement. Behavior is shaped and rewarded to achieve desired outcomes. Behavioral objectives and learning outcomes should be used to assess the student's progression. Students that receive feedback on their progress are more likely to succeed on their final exams. The behavior should be observable and measured. Nurse educators create the learning environment and design the learning experience. The learning experience can be a lecture, simulation, or clinical experience. They can provide positive reinforcement through feedback so that the student can meet the learning goals. The behavioral objectives are used to guide the students in what they will learn. Achievement of the objectives are based on rewards that reinforce the desired behavior. The reward can be positive feedback or a grade in the class. The cognitive learning theory focuses on the internal learning environment. Learning is affected by prior learning, information processing, storage retrieval, and activation. The mind is seen like a computer processing information. Behavior change is based on the student receiving new information. Students learn best when they engage in problem-solving activities because they can use their own thinking. Learning should be active whenever possible. For example, students completing a case study are actively learning and processing information on their own. Passive learning, like listening to a lecture, is a lower level of learning. In the constructivist learning theory, students make their own knowledge, and reality is based on the experience of the student. They use prior knowledge to build a new knowledge. Learners build knowledge to make sense of the experiences. Another portion of this theory is that learning can be enhanced by interacting with others. In the next few slides, 3 different constructivist theories will be reviewed. The social learning theory involves active information processing. Students learn by observing others' behaviors. Students that can perform well have a high level of self-efficacy and can handle taking on complex tasks. Learning is best when accompanied with a social interaction. The environment, cognition, and behavior interact together through a process. The process involves attention such as complexity and value. Retention involves remembering or understanding. Reproduction involves trying something and observing how it went. Motivation is a compelling reason to affect learning and performance. This theory works well with learning strategies such as role-playing, simulation, and clinicals. In the sociocultural learning theory, learning is interactive and occurs in a social context. Real learning occurs in the zone of proximal development. In this zone, the student is mastering a new skill, knowledge, or attitude. The instructor provides support until the student begins to demonstrate mastery, and the educator withdraws support. The nurse educator provides encouragement, role modeling, and breaks down the steps. Student development is based on participation with others. Students are encouraged to use previous learning. Debriefing after simulations or clinicals provide a great way for students to learn and receive feedback. Students become self-aware by reflecting on their learning experiences. The situated cognition theory states that learning occurs when a student is doing something. This gives students the ability to practice, collaborate, use clinical decision making, and creativity. For nursing students, learning occurs in the clinical setting, discussing case studies, role playing, or during simulation. Cognitive developmental theories focus on learning over time. Learning depends on the student's past experiences. There are two theories that I will cover in the next couple of slides. They are the adult learning theory and novice to expert. The adult learning theory states that learners are self-directed and use their past experiences when they are learning. They tend to be more problem-centered and tend to learn better if they view the content as personally relevant. Compared to children, adults have different types of life experiences. They have preferred learning styles and usually prefer to be actively involved in the learning process. Adults like to be connected and support each other during the learning process. Learning experiences should encourage the reflection of the student's past and current experiences. Some other learning strategies that can be used are independent study, inquiry projects, clinicals, reflective journals, and portfolios. Students, with the help of the nurse educator, determine their own learning needs and work together to negotiate their learning experiences. Adult learners are self-directed and should have the option to pace their learning. In the novice to expert theories, nursing expertise develops over time. Nurses pass through 5 stages as they develop into experts. The novice nurse will go through all 5 steps to eventually become an expert. The novice nurse is trying to learn skills, and the expert nurse is in a position to reflect over their practice. They may be able to push for changes in nursing that can improve patient outcomes. The nurse educator must determine what level of students they are working with and what experiences they have already had. Evidence-based teaching practices are used to facilitate learning and meet learning outcomes. Over the next few slides, I will review different types of teaching strategies. The flipped classroom involves students preparing prior to the class individually. Once in class, students are already prepared with the content, and the classroom can be used to create engaging activities within groups in the classroom. This strategy is an active learning strategy that incorporates team-based learning. This type of learning can improve student outcomes, satisfaction, and self-confidence. The only drawback is that some students may not like having to prepare more at home. Games are a great option for reviewing the knowledge of content that has already been taught and can improve retention. The learning is student to student. Games are not only fun, but they are a great way to assess the student's understanding of the content. Collaborative testing is where students are put into small groups to take a test together. This is a great way for students to practice critical thinking and team-based learning. The only drawback is some students may feel uncomfortable having to defend their answers. Response systems use a personal response system to answer questions. The nurse educator can ask students questions and their pool answers are displayed for the class to see. This learning strategy is a great way to engage students in higher level thinking. It also gives them a chance to practice decision making. The nurse educator is able to assess the student's understanding of the content. Simulation has played a part in nursing education for many years. However, during the pandemic, many nursing schools were struggling to get clinical hours for students, so simulation has started to play a larger role in nursing schools. Simulation involves activities that represent potential clinical situations. Students are able to respond to realistic situations without concerns of harming real patients. Lecture is a common teaching strategy that can be used to cover a large amount of content. It can be difficult to keep students engage during a lecture. By using videos, case studies, or podcasts, students can stay engaged. A seminar or group discussion can be done in class or even online. It is an active learning strategy. There should be clear guidelines and objectives to ensure that the discussion is efficient. Group discussions allow students to participate in collaborative and cooperative learning. Mind mapping can be used to learn complex material by diagramming the content into concepts and sub-concepts. Concept mapping are visual diagrams that help students organize information. Case studies can be used to stimulate knowledge, retention, and recall. It can also push students to use critical thinking skills. Socratic questioning involves probing questions to assess the student's thinking. Journaling can be used to connect personal experiences to learning outcomes. Educational theories are used to explain the relationship between concepts in the learning process. They are also used as a foundation of creating teaching strategies. When preparing for the exam, make sure that you understand the common educational theories and how to use them when creating teaching strategies. Evidence-based teaching strategies are used to facilitate learning and meet learning outcomes. Students learn best when active learning strategies are used because they are actively participating in the learning process. When lectures are used, students are passively learning and do not absorb the material as well as active learning strategies. For this presentation, I used Chapter 6 and 14 of Billings and Halstead, Chapter 1 of Caputi. In the next presentation, I will be reviewing ways to modify teaching strategies and learning experiences based on the consideration of diversity, social detriments of learning, and past experiences.